Hello everyone. So the date for NEET PG 2025, there has been a direction by Supreme Court wherein they have allowed the National Board to proceed with the conduct of NEET PG examination on the 3rd of August. So I think we are now reasonably clear on the date, which is most likely to be August 3rd. Yes, there has to be a notification, an official notification that has to come from the national board. But since they have requested the Supreme Court, the NB has requested the Supreme Court for this particular date, I think they are going to proceed with that date itself. So first things first, I think we have got a date now, 3rd August. Okay, right. So to all my dear students, any query that you have got, I'll be happy to answer in the chat box. Meanwhile, I'll just tell a few suggestions, some tips and strategies, how to plan ahead for the next 2 months. This is going to be a very short session, a very crisp session on the planning. Yes, we'll try to do a detailed planning strategy later, but I think I'll just tell you something to do for the next 2 months, at least superficially. Now, I know that the students who are listening to me will mostly be belonging to 3 categories. Number 1, category A, the students who have done a very good preparation for INICT NEET PG. That means decent preparation to the best of their ability. And they were prepared to write NEET PG, but the exam is now postponed. This is category 1, who have done a decent preparation. Category B, they have prepared for this NEET PG INICT, but again, there have been certain deficiencies in their preparation, and maybe the INICT did not go well, or maybe exposed many deficiencies in their preparation. So this will be category B. And then category C students, well, they have not started serious preparation, and mostly the category C students will be the post-intern batch. They have maybe just started off the preparation. So I'll be just quickly addressing these 3 category of students right now. So let me start with the category A of students. Now, category A of students, they have done a decent preparation over the last several months. They have put in genuine effort as well. A few suggestions for you. Now, for you, what I think you should be doing is in the remaining time, that is under 2 months, you have to fit in 2 good rounds of revision. So I think you have to schedule 2 good rounds of revision with a good number of grand tests as well. I think every week you can give 1 grand test minimum. Okay, you have to give 1 GT minimum per week for the next few weeks, except for maybe the last 1 week where I think you need not give the GT. It's better to keep revising. Now, for you, there is another important piece of advice that I want to give you. And the category A students, many of them have personally messaged me as well, sir, there is a sort of fatigue, there is a sort of saturation. Every time I go through the same notes again and again, I feel that, I've done this, again I have to read this. Many of these students are having a temptation to go to new resources. Sir, should I subscribe to another platform, this course, that course, because I've got some extra time now? What I want to remind all my dear students is to resist any such temptations. Please, for the next, 55, 56 days, you have to spend some quality time revising your notes. The trust in your notes should be there, and you have to keep revising again and again. Resist any temptation to go for new resources, because that might be detrimental. If at all you go to a new resource, it should be maybe a revision video to cover certain deficiencies in a subject. Suppose you are weak in medicine and you want to just go through certain systems, at least revision video, then okay, fine. But otherwise, stick to your resource, do not change. Very, very important. Okay. Now, another possible thing that you can do, that is students of category A, that you can do is maybe you can increase the number of MCQs that you solve per day. Okay. Suppose you were going in the 70-30 balance, where 70% of time you were devoting to your reading and or revising, and 30% for MCQ practice. maybe you can change that to 60-40, wherein 40% of time you can devote to MCQ practice. So that is one thing that category A students can do. Do more of MCQs. That is what I would suggest to you. Now, regarding category B students, that is students who have prepared for last several months, but they have definitely noted that after INICT, there are serious lapses in their preparation, at least for some subjects. Now, for category B students, what I would suggest to you is, look, this month, whatever deficiencies you have got, you have to cover up in this month. Don't leave it for the next month. For example, suppose you are weak in pharmacology. Okay, you are weak in pharmacology, and in INICT, maybe pharma, patho, you found it tough, and you understood that there are serious lapses in your preparation. Now, whatever lapses are there, you note down those subjects and you give some extra effort in this month itself. So, category B, whatever deficiencies you have got, please cover up in this month. And after you cover up the deficiencies, please go for one solid round of revision. Okay. So, there should not be a mistake wherein you are neglecting or turning a blind eye towards your deficiencies. If at all you have spotted some deficiencies, that is for you to correct and not to neglect. So I would seriously advise you not to neglect the deficiencies, and you will have to move ahead and correct them. And after that, you will have to go for one solid round of revision. Now, regarding category C students, the students who are fresh into PG preparation and they're having a doubt, sir, I have a doubt. Well, should I go for a structured preparation, like right from the individual subjects, or should I do a short term preparation for the upcoming NEET PG? Well, this is a tricky question, I know, but what I would suggest to you is, well, these 2 months you can utilize for maybe covering maximum subjects that you can. And what I would suggest is, if you are new to preparation but still have a decent idea, okay, maybe during your MBBS days you have done certain subjects decently well, one thing that you can do is, aggressively watch the revision videos of the platform that you're following. You please watch the revision videos. If you're following doc tutorials, QRP 5.0, the revision videos, just go through them, aggressively go through them, and then solve MCQs. So category C students, what you can do is, I again subdivide category C. Some basic knowledge during MBBS, I would still say that, you just give an effort for the next 2 months. You might ask me, sir, I don't think I stand a realistic chance for NEET PG, but still, if you prepare well for the next 2 months, you can carry forward that momentum for subsequent preparation as well. So what I would suggest is, you definitely should do the revision videos plus the QBank. And when you do the QBank, I know QBank is exhaustive. What you can do is, there is the QRP QBank in the Doc Tutorials app. So you focus on the QRP QBank rather than the main QBank. Okay. So that is what I would suggest to one category of students. And the other category of category C students, I've just subdivided category C into two. So those students, if you are totally clueless, then go according to your pace. For example, you are a student who is attending, say, the online live batch of doc tutorials. You have just started your preparation. Let your preparation go in that flow itself, because you will have classes, you attend the classes, make your notes, prepare accordingly. Maybe, near to the exam, you can just watch the previous year recall videos as well. Now, another point I want to tell you is, now that we have got a date, I am very sure that students will now start speculating. Okay, speculating what? It's a shift from two shift exam to a single shift exam. I've already started seeing comments in social media by students. So if it is one shift exam, are they going to make it tough? What do you think will happen to the pattern? Will there be a change? Will it be long stem clinical scenarios? Let me tell you something that I've been telling you all the time. Pattern of National Board of Examinations, very unpredictable, not only for NEET PG. I also teach students for NEET SS. And believe me, over the last few years, I've seen them twisting and changing patterns all the time. You cannot anticipate. And is it a variable that you can control? I'm asking you, all your dear students, is it something that you can control? That is the pattern of question that is going to be asked. No. What you can control is just your studies and your revision. So don't just ponder too much regarding what sort of questions might come. Just think that, look, I've got under 2 months, and whatever best I can during the next few weeks, I should be doing so that I can have an optimal level of performance according to your preparation. Okay, so that is what all of you should try to attain. And please don't be under too much of pressure. I'm sure that INICT ranks, at least for some students, might have been a shock. Sir, I did not do well. I am devastated. I'm disappointed. I don't think this game is for me. I want to give up. Sir, I'm frustrated. I've put in a lot of effort. I want to tell you something. NEET PG, unlike INICT, is an exam with lots of opportunities, correct or not? You've got so many seats, and please do not think that, I'm talking for the students who have not done well in INICT. Do not be under the impression that to be a good doctor, you have to be a topper. It's nothing like that. Yes, if you get a top rank, you will have more opportunities, open in front of you, more colleges, more branches open. But still, even rank 1 gets to select one seat. Rank 10,000 or 20,000 also gets to select one seat. Nobody can do two post graduations at a time, right? So what I'm trying to tell you is there are lots of opportunities in NEET PG. So don't be disappointed. Even if you are not a topper, you still can get the branch that you like in a good college. So don't be disappointed if you put in genuine effort for the next, say, 50 odd days. I'm very confident that you can make a difference. Many students have asked me, so do you think realistically it is possible to have a change in fortune in just 2 months? I was studying for the last several months. Still, I could not, do well in INICT. Do you think realistically in 2 months I can do something different? Well, what you should be trying to understand is what went wrong in INICT. You just ask yourself, was it something related to, say, having weak subjects, or maybe problems with revision, problems with MCQ solving? So take this postponement as a blessing in disguise or an opportunity. This is what is important. Now, you can either think of the mental fatigue that you have, or just think of the opportunity that is there in front of you. You please utilize this as an opportunity. And if you can utilize this as an opportunity, I'm sure that, again, you are likely to get your ranks higher up. So opportunity, converting this to an opportunity is actually very important. I'll take a few quick questions as well. Okay, so one question is the new form that is will be released or not on the selections, the college, I mean, sorry, the for the exam, the center allotment, will there something be released again? I think there is a chance. I'm not very sure on this, but I think there is a chance that they might call for, because they'll have to find new centers, obviously. So there is a chance. And many students asked me, will the last date of internship completion be changed? That I'm not very sure, because this is something that was there in the prospectus, right? So will there be another change in the prospectus, or that I'm not sure. But again, a similar sort of incident has happened before, wherein the exam got shifted for NEET PG, and many students raised a concern that the internship cutoff date also should be changed. And at that time, it was actually changed. But whether this happens this time or not, I am not at all sure. And nobody can take a guess in terms of, NB related matters. Okay, right. So one question, sir, I belong to category B, by Dr. Dan in the comment section. I analyzed that I did a lot of silly mistakes in INI. What should be the strategy? For silly mistakes, it's all about quality of revisions and doing more GTs. You have to improve the quality of your revision, more focused, avoid, all social media distractions as much as possible. Do good rounds of revision. And when you do revision, rather than, when you look at a system like rheumatology, I'm just telling you, for example, one problem that happens during revision is students spend equal time for covering an entire system. but it should be like you already know what your weak areas are. For example, you are learning rheumatology and you already know that you are weak in, say, vasculitis. You should be focusing more on the vasculitis part. You should be focusing on the covering vasculitis, or maybe if you are weak in autoantibodies in SLE wala topic, you have to focus more on that. That is what I would suggest to you. Okay. Uh, so one query by a student, I like your name, Lord Orochimaru. Okay, that's a good name. 6 hours only are able to study, not able to sit for more hours. I think you will have to put in more hours. Okay, I think a bare minimum of 8 to 20, 10 hours. Bare minimum of 8 to 20, 10 hours. I'm not always equating the study hours to the productivity, but again, in such a competitive exam, I think 6 hours is less. And if you feel that you're putting only 6 hours, you have to question yourself why. Is there some sort of fatigue, or is my planning wrong, or am I wasting time? So you please consider that and increase the time. Okay, right. Dr. Akshita Sharma, sir, I've been honest with my preparation, but my INICT rank is 15K. Maybe it wasn't my day. Can I make it? Akshita, something that I would tell you is, see, uh, for INICT, you just see what happened. It was an exam where it was of moderate difficulty level, but with tricky options. So when you have got such tricky options, if you make a few mistakes, what happens is that once you are in that cluster of ranks, okay, then any silly mistake would cost you badly, Dr. Akshita. I've seen that with students. Even brilliant students I know have scored beyond 10,000. Really, some very good students whom I expected to be in top 1,000 ranks, definitely, they've gone beyond 10,000. Why? Because in such an exam where the questions have come from expected topics, but with tricky options, sometimes if you have made any sort of judgmental errors, silly mistakes, it can definitely cost you badly. That is what I want to tell you, Akshita. Don't worry, maybe you had a bad day. Just forget that. You have got 2 months in hand, and I hope that after 2 months you also send me a message that you will be, you've got a good rank now. Okay, right. Roshan is asking, sir, if I subscribe now, will doc tutorials provide QRP 5.0 soft copy so that I can take print out? So Roshan, I think it is there, the soft copy notes in the QRP 5.0, the revision videos. There are soft copy notes, and the good thing is that every topic ends with a mind map as well. So you will see that and appreciate that every topic, the QRP, it is within the app. You can have a the soft copy is there within the app, so you need not take a special printout. It is there within the app itself. The soft copy with the mind map is also there. Okay, right. So that is what you have to know. Aishwarya is asking, so should we do anything apart from our regular preparation to attend UPSC CMS? So this session is actually for the NEET one, so let us not go into that right now. And plan for FMG, Dr. Mahi, we had a session yesterday for FMG by our faculties. So please go through the video there. I think a wonderful session by Dr. Pallavi ma'am, Rajasi ma'am, Dr. Gayatri ma'am, Vandana ma'am, Shivani ma'am. They've done a wonderful session. You can just go through that. Achut Joshi, what is the best way to gain momentum? Since 4 days, it's very, very slow pace. Now, Achut, this has happened to me as well. Sometimes, when I take a break and I restart my studies, I find that I'm lacking speed. So what I did was, I used to have the small alarm clock with me, and I used to put it in front of my table, and I was just searching for that. Yes, there is the alarm clock there in my table. So what I do is that I give myself short targets. Like say 12 o'clock to 12:30, I have to finish something, and that's the only thing that is there in my mind. So I give myself a target: 12 to 12:30, I should finish something, and then I give myself a target, maybe 12:35 to say 1:30. This is my target. So initial couple of days, just to get my momentum back, I give myself short targets rather than putting the plan for the entire day. So I think that strategy of giving yourself short targets might actually work. Okay. Dr. Mahi says not able to cover subjects is what Mahi says. Mahi, you will be able to. And what I would suggest to you is that if you are having some problems in certain subjects, at least go through the revision videos. I think at least, because if you strongly feel that you cannot cover, at least for subjects, certain subjects, you can go for the revision videos. That's what I would suggest. Okay. So another question by Aishu: how should we plan the days left? since we have done with almost all subjects once and did the PYQ2. Again, as I said, no temptations to go to new resources. It's all about doing this resource again and again and again. Maybe you can do more of MCQs, Dr. Aishu. That might actually help you, doing more and more multiple choice questions. Okay. How to do custom modules for these days? Yes, it actually depends. You have to do custom modules. You can definitely do, but again, I think I've already told you the strategies for plan A, B, C. Depending on which category you belong to, you can adjust your strategy accordingly. So Anuj Kumar Chowdhury, good afternoon. The 2020 series is amazing. Kindly continue more of series like this. Let us actually see. We are actually planning something. Maybe we'll plan a few integrated test. Let us actually see. I was just discussing with Vandana ma'am also the other day. So we'll try to put a few MCQ tests, maybe integrating medicine pathology. So stay updated in this YouTube channel as well. We'll try to plan something. And again, we will be having something for you, to help you plan better in the next 2 months. So I want you to stay updated with the Doc Tutorials Instagram page, as well as this YouTube channel for more announcements as well. And again, the medicine 2020 series, I think today we have got the PSM 2020 series coming up, right? If technical team, please correct me if I'm wrong. To the best of my knowledge, today is the PSM 2020 exam series. Yes, it is there. So it's a wonderful thing to do. I've taken interviews of multiple toppers, and for INICT, RDX was a ritual for everyone. They have written it all the time. So I think this is a wonderful exam series to take. It's open for everyone. 24 hours it is open, and there will be a discussion video as well. And at least some of you might have noticed, I have just started posting more MCQs in my 2025 NEET PG WhatsApp groups. So I hope all of you are there in the WhatsApp group. Already we have got 5 groups full of NEET PG preparing candidates. We have got 5 active WhatsApp groups. We'll be doing active discussions. I've already started putting MCQs because many students told me that we are losing track, losing momentum. Kindly put more MCQs. So I'm putting more MCQs, and I'm also going to do one, based on the 2024 NEET PG medicine questions. I'll be doing a recall, system-wise recall. Okay, system-wise recall, wherein the 2024 medicine questions, including the integrated ones with overlap with topics like pharma. I'm going to do a system-wise recall as well, maybe in the same YouTube channel, so you can stay updated. You can also stay updated to my Instagram page. And if at all you are not there in that group, you can send me a message in my Instagram. So my Instagram account is dr_Rahul_Rajeev. dr_Rahul_Rajeev. If you're not there in my NEET PG WhatsApp preparation group, you can inbox me. So we are having discussions of MCQs, medicine MCQs in that group. And for any doubts that you have got, you can put in that group as well. Somebody is asking, Dr. Janani, GT score that is stuck at 120 for the past 2 to 3 months, how to improve? Janani, you have to find out what is the mistake. There are 2 possibilities. Number 1, if you are having these mistakes from areas that you have not read properly, okay, then suppose you are having so many questions from areas that you have not studied, then that means there is a problem with the resource that you have utilized. Maybe you have only gone for revision videos alone, or maybe there is a chance for certain subjects you have not watched the lectures properly. So one possibility is there is a problem with the content. That is one possibility. So if there is a problem with the content, you will have to rectify that. And if at all, Dr. Janani, if you are planning to rectify that problem, you will have to do it this month. Don't leave it for the next month. So any problem with the content, if you want to watch some content, at least in certain subjects, you will have to do it this month. At the same time, if your problem is not that you have done with the topics, but you keep on repeating mistakes from topics that you have already read, what you can probably do is, number 1, you have to spend more time for revision, especially of the topics that you have gone wrong in the last 5 GTs. So one strategy that I would suggest to you is look at the last 5 grand tests and look at these mistakes that you have made in the last 5 grand tests, and you find out what are your weak areas, weak topics. Make a note of them, and maybe you can spend some extra time every day to revise these topics that you have got wrong in the last 5 grand tests. That is what you can do. Okay. And also another strategy that I would suggest to you is you can increase the number of MCQs that you are doing per day. Again, remember what I told you. If it was 70-30, 70 for studies, 30 for MCQ, you can just again increase more time for MCQs, like 40% of the time you can devote to MCQ practice if you feel that you are having a problem in your grand test as well. That is what I would suggest to you. Right. So Rakesh is having a query. Sir, not able to do revisions with full focus. Give some tips for that. Well, Rakesh, again, I'll tell you first, cut off all the distractions that you've got. Make sure that your study environment is good. For example, as I'm speaking to you, this is my study hall. Okay. So when I am studying here, okay, yes, I do study even right now for all of you every day morning. When I wake up, maybe 4:30, 5 o'clock, I spend some time to study something that maybe I'm not so strong at. So I do spend some time. So make sure your environment is good. It's not noisy. There are no distractions. Second, this culprit, your mobile phone, try to keep it away, keep all the social media distractions away. Number two. Number three, you give yourself targets. It should be time bound studies. You try to keep a check on the time that you are devoting for your studies. You need to know, okay, morning session, I need to cover at least these topics in these many hours. You have to give yourself targets rather than thinking, okay, let me learn anatomy today. You try to divide it into sessions: morning session, afternoon session, evening session, and you plan the session accordingly and subsequently do the studies and revision as well. So I think Dr. Thailang is asking, sir, 120 corrects, can I rise it to 150 corrects within 2 months? Well, I'll tell you something. It's possible. It's possible if you can put in your best effort. It is possible, but I'm telling you, magic may not happen. I cannot guarantee you that it will be there. But what I can guarantee you, the only way in which you can get this 120 to 150 correct is through giving your best effort for the next 2 months. Only that it is possible. Okay, right. So that is it. I think I've covered most of the points. I think it's time to wind up the session. Any more queries you have got, you can leave it in the comment section of this video if at all you are watching it later. And you can stay updated with the doc tutorial social media channels as well for certain things that we are going to do to help you revise better. Again, we are not going to bombard you with any new resources. No, that's not what we're going to do. But to help you revise properly, we'll definitely try to do something, and we'll keep you updated in our social media handles as well. Thank you everyone for joining, and keep studying well. All the best for your exams. Thank you so much. And we'll have definitely more such strategy videos as well, maybe more detailed ones coming later in this YouTube channel. Thank you so much.